A very good evening to Sir Izuddin and my friends. So myself is Yasuda.
And I am Darshni Silvanan.
And my name is Sudashini Vijaykumari.
My name is Madhvita Munyadi.
And lastly, I am Srinivasan Kurusil.
So we are here to present our assignment, and the sport we chose is football. So let's start with our slide. Okay, let me explain about what is football. Football is the most popular sport in the world. The origin of this game was found in Japan and China. And it was popular in Europe, and then this game consists of 11 players, including the goalie. Therefore, we choose 5 common injuries in this sport. Those are dislocation, fractures, sprain, strain, and concussion. So let's start with our first presenter for the first injury, which is dislocation.
So, okay, as for the first common injury that found from a football game is dislocation, where what is dislocation? Dislocation is actually an injury when a particular bone slide out of the joint. So it's basically will happen any part of the body of the joint. So how is dislocation happen? It's incidents that mean forceful done by any player without any swallowers in any situation. So basically, it's most common in football, where they have to play a football forcefully, and the common dislocation is happen at kneecap dislocation or patellar dislocation, and is locating in knee joint. So as for the sign and symptoms, so basically it will feel very painful, especially when you're standing with the whole of knee dislocation. And it usually occurs the swelling area, the joint, where known as water on the knee. And another symptoms that can be found from dislocation part is bruising. Bruising occurs around the front of the kneecap during the healing process. So as for the treatment and prevention part, so basically for the treatment is first the player not to move right away after injury, because it will cause them more painful. So the most common thing they have to concern is medical attention is required. So before doing any medical attention, the first thing they have to do is icing the injury area, because it helps to reduce the pain and swallowing. And when you get the medical attention, you have to get an immediate x-ray. Then once you get to the clear picture of the x-ray, the doctors will get a close reduction, where they will try to put back the injured part to the place. So as for the prevention, what you can do before getting any dislocation, first you have to pay extra attention towards the safety and health whenever you're doing something or playing games that's so forceful to yourself. Next is wear extra protective gear during contact sport, and also regular exercise is much needed, where you have make your joint more stronger so that you won't get any dislocation easily. So last but not least, wear knee braces to avoid any dislocation areas.
Okay, so for the second injury is elbow fracture, which is known as radial head fracture. This common fracture, which is the elbow fracture, is injure the radius in falling onto an outstretched hand. The contact with the ground sends a shock wave rippling up through the wrist, forearm, and into the elbow. When the arm is outstretched, think the forearm and the palm is down like this. So there is specially sends force into the radius, which is the radius of the elbow. With enough force, the radius break and the arm busts. Radius fracture are quite common, making up roughly 30% of all the elbow fracture, which is very common in football for the players. Okay, as for the sign and symptoms of this elbow fracture for the first one will be pain on the outside of the elbow. Once you have fall down, facing your palm on the ground, the first one will be like pain on the outside of the elbow, and then second will be swelling in the elbow joint. And once you have gone the swallow thing, so the third one, you will be facing difficulty in bending or straightening the elbow because of the pain. And the last is inability or difficulty in turning the forearm, which the palm up to palm down or vice versa. Like you can't even have you will have the difficulty to turn your forearm and it will give some impact in your elbow. So for the prevention, it's not possible to prevent this fracture because this is a very common injury in this football. So there are some steps that you can give some more like you can give more concentration in those ways, like you have to maintain strength and agility by exercising regularly. And the second one is like wear protective gear. And the third one is like learn proper techniques like proper techniques that you won't fall down on the ground. And the third is like take steps to reduce your likelihood of falling. So you need to have some kind of technique for not for avoiding your fall. Okay, the last final thing is like treatment for this injury, which is the elbow injury. So in this, there are 4 types of classification of this injury, this elbow injury, because the first one, we will name it as Mason types. So the first type will be minimize displays, no mechanical block to reduction, which it is not serious. Like it will be have some kind of small crack in your elbow, but it's not too much of it won't give so much of impact in your elbow. So you can either wear the sling like in this picture, for example. And the second, third, and fourth is very very dangerous. Like you have to operate, you have to take some X-ray, and then later you have to know you will be observed, so that we need to do some operation based on this. So the third one is before going to an emergency, like before you getting the elbow dislocation, this is the last part. Like you have to do the operation by doing some CT scan or X-ray. So this is the common classification of getting this treatment. And the easiest or the unpainful thing is like wearing the sling, where you have some kind of small crack in your elbow and it's not very serious. So for the third injury, moving on to my friend.
Let me explain about the third injury, which is ankle sprain. So what is ankle sprain? Okay, basically sprain. Sprain is a common injury that football players experiencing in their feet. You know, a sprain happens when a ligament is stretched or torn. So when you have a sprain, you may have injured one or more ligaments. So a sprain happens bone to bone. In football, the players might get injured from running, tackling, twisting, shooting, landing, and jumping. So ankle sprain occurs when a player's ankle is forced to move out of its normal position, which can cause one or more of the ankle's ligaments to stretch. So essentially in football, ankle sprains happen quite often when an opposite player is stepping or landing on the footballer foot. So let me show a small video of how ankle sprain can occur.
Is part of the game. Players most often suffer ankle sprains. If they turn or twist too quickly during play, the foot can roll onto its side, damaging the ligaments and tissue which support the ankle. On the inside, the deltoid ligament. On the outside, the lateral ligaments. In front and behind the joint with the tibia and fibula leg bones, the tibiofibular ligaments. A sprain most commonly occurs when the anterior talofibula and the calcaneofibular lateral ligaments stretch too far or tear. Front tibiofibular ligament damage accounts for 10 to 20% of sprains.
So that's all from the video. So now I will move on to the sign and symptoms. So what are the signs and symptoms of a sprained ankle? You know, sometimes they're very depending on the severity of the injury. So the initial symptom is the ankle will be very painful when you bear weight on the affected foot. And then it will be swelling and bruising right after their ankle is twisted. You know, sometimes it's a blue and black and so on. So besides inflammation and tenderness when you touch the ankle, to add on, sprained ankles also happen when it produces a loud snap or crack, like like that. So that's all from the sign and symptoms. So let me move to treatment. Okay, as for the treatment, essential treatment for sprain is to follow RICE treatment or method which speed up healing and reduce the sprain. So as we know, RICE is a method where R for rest, I for ice, C for compression, and E for elevation. So the very first step is rest. So what you have to do is support the injured part in a comfortable position, cut back your regular exercises and activities of a daily living. And then an injury like a sprain requires a change in your normal routine to let the area heal. So you have to just take care of your ankle very well. As for the second step, you have to apply ice. So apply an ice pack to the injured area for 10 minutes. So do this like 4 to 8 times a day. You can use a cold pack, ice bag plastic, filled with ice wrapped in a towel. So, and even for better way of putting or applying the ice, you have to concern is to use an ice massage method. So where you have to massage in a circular motion or back and forth motion over area of a concern. So the icing process, it will be very effective and help to reduce the swelling and also the pain. As for the third step, you have to do is compression. So what does it compression mean? You have to wrap the concern area. For an instance, wrap the ankle with elastic medical bandage. You cannot use a normal bandage or normal clothes just to cover your ankle, but then you have to use appropriate medical bandage. So this will help to decrease welling associated with the affected limb. And then to remember, do not wrap so tight because it will cause a blood circulation issues and tingling, and also it can increase your pain. So use the compression bandage for 2 to 3 days. You have to be often in using this bandage. As for the last method, as for the last step, you have to use is elevation. So elevation is if it is an ankle sprain, when the player is resting, you have to place their ankle at a higher level of elevation than the heart, especially at night. For example, you have to put your leg on the top of your pillow, and then you just need to sleep conveniently. So this will allow the gravity helps to reduce swelling by draining excess fluid. So these are the treatment that we can do for the ankle sprain. And last, I will be explaining how to prevent ankle sprain. So there is a numerous way to prevent sprained ankles. The initial way is that a player should be concern is to always warm up before they start playing any activities that are related to sport. If let's say if a player is about to play a football, he or she have to do warm up before they are progressing their playing activities. Secondly, be aware of walking through the uneven surface. Always remember, if you feel the surface is unbalanced, try to avoid doing heavy exercises, because at the end it may affect your ankle sprain heavily. You have to walk, if let's say you are playing football in a field, you make sure that you walk in a right and a balanced surface of the area. So if let's say the area is unbalanced, try to avoid it. So this is how you can prevent the ankle sprain. And lastly, keep in mind that to wear a shoe that appropriately fit your foot. Wear a shoes that are flexible for any sport activities is a very important. So to wear an appropriate shoe is a fundamental part of your foot. So I think you have to concern that to wear a flexible shoe, you do not wear a loose or also very tight shoe, so it may occur ankle sprain whenever you play football. So I think these are the examples on how you can prevent yourself from ankle sprain. So that's all from me. Thank you for the opportunity. Now I will pass the floor to my co-partner.
Thank you, Sudha. The next common injury is hamstring strain. Human being can strain any muscle in the body. A strain is an injury, either a muscle or tendon generally. This injury occurs due to overuse, force or stretching of the muscle or the tendon in the body. There are several types of strains, and football players usually faces hamstring strain. They usually had high risk of strains. This happens when the players run fast during the match, kicking the ball in force or sprinting. Hamstring strain, which is also known as pull hamstring. Hamstring are long muscles that extended down the back of the thigh because hamstring works to pull back the leg and bend the knee. They can be injured during running, kicking, or jumping. Next. Secondly, signs and symptoms for strain injury. Normally, strain injury localized swelling, cramping, or inflammation, and with a minor moderate strain, usually some loss of muscle function. Players typically have pain in the injured area and general weakness of the muscle when they attempt to move it. Severe strains that partially or completely tear the muscle or tendon are often very painful. Strains vary in severity from first to a third degree strain. First degree strain only involves a few muscle fibers becoming damaged. Effects of the injury may not be felt until after the match and can include muscle cramp. Then the second degree strains affect a larger amount of muscle fibers and the effect will be felt straight away. The pain will be more acute. Walking will be difficult. The muscle may drop when extracted. Finally, third degree strains result in a complete rupture of the thigh muscle. A sharp pain will be felt immediately and it will be incredibly painful to walk. Besides that, the best way to prevent hamstring injuries is to keep our muscle in a good shape. Here are some ways to help protect ourselves against them. Firstly, we have to warm up properly before exercise or intense physical activity. As for example, jog in a place, jumping jacks, dynamic stretching, and also static stretching. Secondly, keep our muscles strong and flexible. Get regular exercise and adopt a good stretching program so that our muscles don't get a shock when we do an intense workout. Next. Last but not the least is the treatment. There are quite a number of treatments that can be conducted for the players during the strain injury. Treatment depends on the severity of the strain. Regardless of how serious it is though, players should use the rest, ice, compression, elevation, the RICE treatment immediately after sustaining the injury to reduce pain and swelling, lessening the chances of it getting worse. Players may recover from first degree strain by avoiding exercise for 3 weeks, whereas for a second degree strain, 4 to 6 weeks of rest is required. For more serious third degree strains, surgery may be necessary to repair the rupture. 3 months of rehabilitation usually follows the surgery, during which players will do gentle resistance exercise, which gradually restore the thigh muscle to its full strength. Yeah, that's all from me. Now I'll pass the floor to Srinivasan Gunasilan.
The first was concussion. Okay, concussion, first of all, it's commonly known as brain injury. So concussion is a type of traumatic brain injury that may occur when players hit or clash their head or body very hard with a high impact. Therefore, it can be cause the brain to move quickly inside the skull, which can damage brain cells and tissues. Concussion is well known in sports, whereby playing sports can increase the player's risk of fall and concussion with the objects or other players. As for the signs and symptoms, firstly, the player will face a sudden attack on the head, and the player will feel a ringing sensation in their head or ears, which they might shrug off dismissive. He also will having a nausea or vomiting, dilated eye pupils, and trouble balancing after the game ends. The next sign will be headache, dizziness, sensitive to the lights, or nerves numbness. Next slide. Okay, as for the treatment, the neurological examination for a concussion, which the doctor will test for your balance, coordination, vision, hearing, and reflex. The player have to have a complete rest on both physically and mentally rest, where it takes up 7 to 10 days until all the symptoms are gone. And lastly, the coaches or the satisfied trainers can perform an immediate procedure slide line evaluation, which to the monitor on symptoms list. For the prevention, all the athletes should be trained in safe sport techniques and follow the rules in the game. For the football players, the coach can teach them a proper technique and ways to avoid the hit or clashing heads while they are playing the soccer games. That's all from me. Thank you.
So that's all from our group. Thank you to my team and thank you to Sir.